Hello colleagues, good morning and welcome to this short video about low vision devices. My name is Dr. Sam Agbo and this is where I work in my clinic here in Nigeria. Yesterday we discussed about the use of low vision devices and I took time off to show you some of these devices that I use in the clinic. We did mention about telescopes that we use for far vision. And here is an example of a telescope. This is an example of a 3x Keplerian telescope that we can use to correct far vision for low vision patients. And as you can see, I am trying to focus it. So usually as a clinician, you would use this, focus it first for the patient before you can give to him. So this is just an example. You can have a closer look at it. An example of a telescope. More like the binoculars you know, but in monocular form. Then moving on, we did mention about clip-on telescopes. And this is an example of a clip-on telescope. If you can see at the back, it has a place where you can use to insert on your frame. It comes in different powers and magnifications, just like the 3x. This one is about the same, 3x. So when someone is wearing a spectacle lens, his prescription, the low vision patient, he can clip it on the spectacle he's wearing in the better eye, so that he can use it for sport viewing. Then also we talked about devices that we use for near work, that is for reading, and we did mention about handheld magnifiers. This is an example of them. This is a 5x handheld magnifier, and all this is illuminated handheld magnifier. It has a port where you can insert your finger batteries. This is another one we have. This one is a 4x magnifier. They are all handheld, and so if the low vision patient is reading, he can place it at a distance where he's able to see, and then we're swiping it as he reads the material. So depending on the value you find during your low vision refraction, you can find out the handheld device you can use. We have a lot of them here. There's a smaller one. It's actually not a smaller one, an 8x handheld magnifier. We talked about the dome magnifier. This is an example of it. As you can see the shape, the way it looks like. So essentially the patient will place it on top of the material and then move it as he reads the material. It boldens what he is reading. Also yesterday we talked about the CCTV. Here's an example of it. This is what I was describing as the mouse, the part that looks like the mouse. This is it, which you place on your reading material, as you can see in the packet of it. You can see that it is placed on a reading material. Then this is the section or the part you connect to your computer or your television. You can see that it has a port where you can connect it to your computer and it boldens what you're reading. Let me show you an example of someone using it to read a drug prescription, as you see in the carton here. You can see a lady here who is using it, and you can see his computer where the thing is boldened on the monitor, and she's able to read exactly what is on her drug prescription. So that is how the CCTV, it's also known as the digital magnifier, that is the way it functions. These are all optical low vision devices. And what else do I have here? During the measurement of visual acuity for low vision patient, we did mention about the flip cards. And please remember that we said that you do this at a distance of 4 meters, not like 6 meters in your usual VA. So that is how you do it. And they are in octotypes, as you can see. It keeps decreasing. You keep turning it at 4 meters rather. That is the testing distance. Keep flipping it until you see it's getting smaller. So that's what you use when you are doing your low vision visual acuity test. There's also a large one that looks like a chart, which more like the large one, the logMAR chart. That's what I have here. So you also stand at a distance of 4 meters and you show the patient this chart. That's a tumbling E, and he looks at them. That is what it looks like. All right, moving on. We did mention about contrast sensitivity in our discussions, and I have this Heidenhaady low contrast test. This is what it looks like. So you begin with the first, as you can see, and the percentage of contrast is mentioned here, 10%. Somebody who is able to see black and white doesn't really have a high sensitivity to contrast, because black and white, there's a sharp contrast. So you keep turning it like we mentioned. After this, you see the next one, and this is about 25% contrast. Then you move to the next one, and then to the last. If you can look at this last one, that is about 1.25% contrast. Anybody who is able to see this will agree that it has a very high contrast sensitivity. And in low vision, it's also very important that you test. Of course, we did mention that contrast sensitivity test is also part of the visual function test that we carry out in the clinic. So that is it. It's referred to as the Heidenhaady low contrast sensitivity test. That's also another thing we use here. So also for the near chart, we have a near chart that we use here. These are the two. They're basically the same thing that we have here. So that's it. You see the way it is, and the readings are on the left and right side, depending on what you want to use. If you want to use the feet, the 20/20, or if you want to use in decimals or in logMAR, they are all stated here. So it's easy to read. So when we talk about best corrected VA at near, this is what you use, and then your target VA, so that it can help you to work out the value of the magnifier that you prescribe for a low vision patient. Next, we talked about the reading stand. Here is a reading stand. So to make it easier, although this is not an optical device, it comes under the non-optical device, what you may call ergonomics, so that the patient will be seated well and his reading material will be positioned well as he reads. It's adjustable. We can prop it up or down depending on the height and sitting posture of this patient. And we talked about how to measure visual acuity of little children. In fact, from 0 to 6 months, infants. This is the Lear paddles that you've been hearing about. And you see that are gratings. On my left is just a blank one in gray color, which is a guide for you And then on my right, you see the ones that has gratings. So the ability of this baby to find out or to follow the paddle that is more coarse will help you to know whether to measure his visual acuity. Please note that this visual acuity is measured at 2 feet or 57 centimeters. And this is how you flip it, holding it in your hand. You flip it this way, and you watch the movement of the eyes of the baby to be sure which one he's following. Ideally, he should follow the ones that has gratings, which is the one. There are other ones. Have a look at this. So the more coarse ones are the ones that has wider gratings. So you begin from the smaller ones to the bigger ones that have more gratings, and you flip it this way. And you also, the clinician, notices or observes the movement of the eyes of this small baby. This way you can measure visual acuity. The readings are here on this thing. It is mentioned in circles per cm. It's written here, like the one I have is 0.25 circles per cm. All others have their values written on them. So depending on where the baby stops in following the gratings, you can now record his VA or her VA using that. So basically, that's the little we have, or the much we have in terms of low vision devices. And don't you forget that we mentioned yesterday that there are non-optical devices, which I don't have here. We mentioned about wearing of face caps, recommending of sunscreen protection cream for albinos, and thick felt pen, which I don't have here. But basically, in a low vision clinic, this is what we use. I'm sure you will find this little video interesting. Please like, subscribe, or comment at the comment section of this video, and let's talk about this later in our next classes. Bye.